Hello. Today I am going to walk you through the best practices for rehabilitating the American alligator, a species whose care requires precise scientific knowledge, strong veterinary partnerships, and a commitment to public safety and animal welfare. Although this species is considered a conservation success story, it remains federally protected, meaning rehabilitation must follow strict permitting requirements and the professional standards established by the National Wildlife Rehabilitators Association and the International Wildlife Rehabilitation Council. The first step in it is assessing three factors: the animal's medical prognosis, its welfare, and whether it can be eventually released safely. Stabilizing temperature, hydration, and shock is essential because crocodilians are extremely sensitive to thermal and metabolic imbalance. From the start, an experienced wildlife or reptile veterinarian must be consulted, since decisions about pain management, diagnostic imaging, or treatment planning requires species expertise. In cases of severe trauma, chronic debilitation, or blindness, humane euthanasia may be the most ethical option. The AVMA's Guidelines for Euthanasia of Animals is a source that's credibly looked at. Safe and appropriate handling is crucial, not just for the staff's safety, but for the alligator's well-being. Only trained, permitted personnel should attempt capture. Many states, like Florida, require documented experience in crocodilian handling. Improper restraint can cause injury, stress, and even death, not only to the handlers, but to the animal itself. Tools such as catch poles, nets, and reinforced crates should be used carefully, and for larger or highly stressed alligators, chemical restraint is often required. Peer-reviewed studies show that anesthetic combinations can be safe and effective, but only when administered by a qualified veterinarian. During transport, alligators must be kept in a strong, escape-proof container with ventilation, minimal noise, and appropriate temperature control. Housing plays a major role in rehabilitation success. According to the University of Florida's IFAS guidelines, enclosures should provide both land and water areas, allowing for alligators to submerge and haul out naturally. Surfaces must be non-slip to prevent limb and spinal injuries, and fencing or enclosure walls must be secure and impact resistant. Many of these enclosures consist of sand or fine-like dirt to support a living habitat that they are in naturally. Maintaining a thermal gradient allows the animal to thermoregulate, and indoor environments should provide full-spectrum lighting that supports normal behavior. Biosecurity is equally as important. Quarantining new arrivals, using footbaths, and disinfecting equipment regularly helps keep the transmission of zoonotic diseases or from diseases from species to species within a specific area minimal. It is also really important to keep personnel movement controlled to prevent disease transmission in the same way. Visual barriers and predictable routines can help reduce chronic stress of the residents there temporarily. In rehabilitation, nutrition must mirror the species' natural carnivorous diet while meeting modern standards. The American Veterinary Manual recommends a varied diet of rodents, poultry, fish, and meat, with vitamin E and thiamine supplementation when fish are solely fed. It is also helpful to add vitamin E and thiamine when fish are fed regularly, as well as an option diet. Feeding must avoid conditioning the alligator to associate humans with food, so keeping interactions minimal, like the use of tongs or remote feeding methods, are widely seen and normalized. Medical care typically focuses on trauma, such as boat strikes, hook injuries, intraspecific aggression, as well as contamination events like an oil spill. Supportive care includes hydration, antibiotics when indicated, wound management, and importantly, pain control. Recent studies have demonstrated that hydromorphone provides measurable anesthesia in American alligators, underscoring that crocodilians both feel pain and the benefit from modern veterinary anesthesiologic protocols. Before release, alligators must demonstrate strong swimming abilities, normal submersion and surfacing behavior, proper coordination on land, and a normal riding reflex. They must maintain an appropriate body condition score, have healed from injuries, and retain a healthy wariness of humans. Release locations must be approved by local or state wildlife agencies and must provide suitable habitat. Some programs now track released alligators using tags to evaluate long-term success and improve rehabilitation protocols for the future. When done correctly, rehabilitating an American alligator is more than just treating an individual animal or the individual species. It protects keystone species, supports wetland ecosystem health, reduces human to wildlife conflict, and reflects our responsibility to provide wildlife care that is ethical, safe, and science-driven.